Hello, welcome to the daycare center of Athens, a clinic that MSF is running for the people that do not have access or they're facing a lot of obstacles to access the healthcare system. That means they do not have their papers, they are not registered, or they have been rejected and still they do not have a paper that allows them or makes them visible to the Greek health care system. Even if they do have something, they may have obstacles to access the system in itself because of their language burden or other complications of bureaucracy that may exist in the system and are difficult to understand, especially if they are in short period here in Greece. So my name is Ioanna and I'm trying to, let's say, drive you through what we do in Athens. So anybody that wishes and has a health need for any reason will drop in the daycare center in Athens, and they will go first through this magic room that is called triage. The nurse will assess their physical condition and either will be really referred internal to the daycare center in Athens, or we'll try to liaise with other organizations or other sources that can really serve the need that the person has. What we do provide here in the daycare center is really sexual reproductive health care, mental health care, and treatment for non-communicable diseases like it is diabetic, hypertension, and other chronic diseases that are affected and they are difficult to follow up, especially if you don't have any access to medication, to proper lab exams, and to really diagnostics that can support the care. So once the person is somehow triaged through our nurse here, they come in the reception and they are booking their appointment. Now our receptionist will give them this little card where they will have their unique registered number. And as you see here, the two very well-known kind of pictures is a WhatsApp and Viber connection in different languages. So in case they need something urgent, they can contact these numbers and really come across to see what we can do. Hello. That was Yota, our social worker. This is the waiting area where we stand now, and here is our corner for the children, because we have patients that do have children, and actually it was always an issue how they can be really have a proper consultation themselves, and who will take care of their children while they are in any consultation in the daycare center. So there is a magic woman that we call Nani, and she's taking care of the children around here. Welcome to the Sexual Reproductive Health Department. Here we have our midwives. And hi Anna.
Hello.
Anna is one of them. Midwives. I pass the floor for her to explain what we do in the sexual health department.
Okay, here we have a consultation room. We examine all the ladies, all the pregnant ones and non-pregnant. Here we see all the sexual transmitted diseases. We have machines that we can provide to the patient some extra samples about the cancer of the uterus and other infections that we cannot detect through clinical image. Also we give contraceptive methods here to all the population. We inform all the ladies about the delivery, about the postnatal period. We refer them accordingly if we need the hospital's help. We go through all the population and we ask the needs, and accordingly we give all the all the information that they need and the help.
So this is the cabinet for the non-communicable diseases. Normally a doctor and a nurse are taking care of the patients that are suffering chronic diseases and they need a long-term follow-up. And in the case they decide to leave the country, then they provide them either with the right instructions or the proper medication so they can cover up until they reach the place of their destination. So this is what we call the NCD department, standing for Non-Communicable Diseases Department.
There we go.
Yeah. Another essential component that it is usually very much it's what we call here the hidden heroes, because they are not in the medical front line as we are used with medicine, with MSF. They are the social workers and the lawyer that, at least in this context, it's their support essential and complements our medical activities in many different ways. For example, they are the ones that are identifying needs that may affect their health status, but they are not directly addressed through DCC. So they will liaise with the community and other sources that are existing in the community or with the public health sector to provide and to liaise our patients with the proper support they need in order to really take care of themselves and maintain their health status. Essential in Greece and living in Greece is your legal status as well, because it's what actually makes you visible in the system. So it's an essential component of having access to the healthcare system. And our lawyer is making sure that at least our patients exhausting our possibilities to really have access and proper legal status, stay legally in Greece. That's quite an effort and not always successful, unfortunately. We are in the floor for the mental health unit actually. So we have the psychologists that are addressing the mental health issues. They're doing quite a comprehensive package of 12 sessions to really treat the most urgent matters, and then accordingly either they liaise with our psychiatrist where he can provide medication if necessary, or liaise with other sources in the community to get the proper support. Here actually is where they are holding their sessions. And as we may have people that they may benefit from a group session, we have also a room for group sessions as well. Okay. Right, so all these services wouldn't be possible to be provided if we didn't have a quite significant group of cultural mediators. And how actually we are able to follow up what is going on out there in the various communities, this is obtained through our team of health promoters that they are also in various languages. So let's say the daycare center here in Athens is our core activity, but we still go out there to reach different needs of our patients in different locations. So that means practically we are operating in 5 camps all around Attica, and we operate also in different locations within the city of Athens to really see what actually and whom actually we miss in the daycare center.